So you are all welcome to today's session on our webinar at the Center of Excellence in Migration and Global Studies. I am Dr. Annette, the director of the center, and today we are going to have a very interesting discussion. We have our presenter who is a senior dental staff at the Department of Preventive and Community Dentistry in the University of Iowa, all the way from the United States of America. Is our very own, because she's in the United States, she is a full-fledged Nigerian. So I will start by introducing her so that we go straight to the business of the day. Our presenter, Abim Polan Oladayo. She is a public health dentist with over 3 years of clinical and public health dentistry in Nigeria and her career began in an outstanding education at the College of Dentistry of Ibadan, where she received her dental Bachelor of Dental Surgery, BDS. Subsequently, she furthered her education with a master's in public health degree at the University of Southern Mississippi, United States of America. And due to her passion for improving the public's health by applying evidence-based intervention to develop practical solutions for disease management and health promotion. That is why she did her master's in this university, the Southern Mississippi University. As an early career dentist, passionate about making a contribution to the improvement of craniofacial genetics locally and globally, she's currently a graduate researcher at the Iowa Institute for Oral Health Research, where she leads the ethics, legal, and social implications of genomic research in the African Population Project at the Butali Lab. She concurrently holds the position of Senior Dental House staff at the Department of Preventive and Community College of Dentistry, University of Iowa. In addition to her experience as a dentist and a public health professional, she is passionate about engaging in cutting-edge research to discover new perspectives useful for expanding the horizon of genetic research in the African population, the results of which improve the study of African health problems and allow for innovative solutions to be developed. Today, she is taking us on migration, not dentistry, not public health. This shows how versatile our presenter is. Our topic for today's presentation is the economic impact of migration, a case study of the United States of America and Nigeria. So, like I said, Dr. Abibola is an all-rounder, because you would have expected that she's going to pick one of the medical diagnoses I talk about, but no, we are going to hear her talk to us about economy. And this is very interesting to me, very thrilling. And that is why I'm excited that she's here to share her work with us. So, Dr. Abimbola, I'll give you 35 minutes to talk to your slides. Thank you, and you're welcome.
Thank you, Dr. Anita, for the introduction. And I would like to thank everyone for coming today to listen to my presentation. As she rightly said, I would be presenting this talk on the economic impact of migration. And I'm trying to look at it from the standpoint of a developed country and a developing country. So why not use a popular example, which is the United States, and a country which we all love and we are familiar with, Nigeria. And in the next couple of slides, I'll be using this outline to discuss this topic. So I'll talk about I'll make a brief
Sorry to cut you
introduction.
short. Sorry, doctor. I wish your video, is it showing or is it a picture?
It's showing.
Okay, sorry.
It appears that I'm not moving, right?
Yes, go on. Maybe it's my network.
Okay. So I'll start with the introduction and talk about a few interesting facts about migration, the growing importance of migration, the popular origins and destinations of immigrants around the globe and in Africa, migration patterns, migration and the economy, subsetting on the US economy and Nigeria, the benefit of migration and the disadvantage to Nigeria, the conclusion and acknowledgement. So to simply put, human migration is the movement of people from one place to another, and this could be with the intention of, staying there temporarily or permanently. And historically, migration is as old as whatever it is we can think of, and it goes as far back as when people were moving from one part of the globe to another, where there was nobody, to the more recent shift in global population due to labor migration, refugee migration, and urbanization. And it's been made more easy with the fact that you can move between countries now very easily, and advances in transportation. And individuals who move can be categorized as emigrants, immigrants, or refugees based on the direction of movement and also the situation that is forcing them or prompting the move. And also, we could have internal migration, external migration, again, emigration and immigration, as I've talked about, and return migration, which is not so common to Nigeria, and seasonal migration, which I would say is more common intra-Nigeria. We have people moving from the north to the south, and all of that. So and this could be due to labor or climate situations. So the big question is, why do people move, or what factors do you think drive immigration? And this could be push or pull, and it's just as it means, push, something that forces people out of a place that they love or call home, and it could be due to poor medical care, few job opportunities, or just searching for greener pastures. And pull factors will be the factors, attracting people to a new place, better job opportunities, security, or better living standards. And also, migration can be voluntary or involuntary. So in this case, these factors would also fall under the push factors. Now, all regions around the world have acknowledged to how important migration is to their developmental growth, population growth, and also economic growth. And this one is particularly looking at Europe. Now, the European Commission has said that by 2030, the employable age is going to shrink by 20 million. And this shrinking workforce only translates into something. There will be an increase in the number of dependents, and this could lead to either stagnation or decline in the economic growth. And this could invariably lead to the reduction in the competitiveness of the region compared to other regions, economic regions of the world. And this is not something that world powers like that or developed countries like that would want to happen. And as far back as 2000, the UN has published a report that migration will have to double to maintain the size of the working population. And without sustained migration by 2050, the European Union would need 2 workers to pay for 1 pensioner, which is a disaster to happen, if you would ask me. And right now, 1 out of every 35 person in the world is an international immigrant. And interestingly, just 12% of the countries in the world house 75% of international migrants, which would say to how strong the pull factors in these countries are. Now, looking at migration in general, is there any benefit? And research has proven, like any other process, that migration affects all aspects of our lives, and it could be positive or negative. Now, talking about international migration, it could create significant financial and social benefits for those migrating, their families, the country that they are coming from, and the country that they are going to. And as I've said, it could be positive when you have, mixing of cultural experience and races, or negative where you have, cultural tension, racism, and discrimination. And again, because you have migration being selective of a particular age group, meaning those that are young and those that could blend easily into the workforce, it could cause a demographic shift benefiting the country that is receiving and much more to the detriment of the country they are coming from. Now, to the topic of the day, the economic impact, which is invariably the most important topic or the most important impact that countries will be interested in. And I got this very interesting statistics from the International Organization of Migration, their most recent report, which was published in 2020. And as it stands, or as of right now, we have 281 million international migrants in the globe, and they account for 3.6% of the global population. Now, this group of people successfully transferred or sent back home money totaling about 717 billion in 2019, which is a lot of money. And again, of this population, you have 164 million being migrant workers or falling into the category of people that participate positively in the workforce. Now, for popular destinations, we have Indians being the top in the list of countries with the largest population in diaspora in 2020, and they have 18 million people living outside their country of birth. And the 5 countries here are the top 5 countries that Indians would move to. This was followed closely by Mexico, Russia, China, and Syria. And the USA still remains the largest destination for immigrants, and this was followed by Germany, Saudi Arabia, Russia, and the United Kingdom. Now, this figure shows the proportion of international migrant population and also the migrant share of the total population. As I've said earlier, US is the biggest destination for migrants. However, to my surprise, the United Arab Emirates and China stand Can we all mute our mics, please? So UAE and China, they are the top countries that...
Sorry, please kindly unmute yourself. Unmute yourself, Dr. Abimbola.
Okay,
yes,
can you hear me now?
Yes.
Thank you. So moving on to the origins and destination in Africa. Egypt stands as the #1 country in Africa that produced the largest number of immigrants or international immigrants. This is followed by Morocco, South Sudan, Somalia, and Sudan. Nigeria, unfortunately, or to my surprise, didn't make the top 5 list, but I still got the stat and put it here because I'm going to be talking about it later in one of the slides. Now, to correct a common misconception about migration patterns, it's not uniform and it varies widely across regions. And what is commonly assumed is that most African international immigrants would leave the continent and move to maybe Europe or somewhere, but this is not the case. Most international migrants in Africa and Asia move intra-region. And as we can see on this chart here, you have migrants to Africa, migrants within Africa, which is the highest in the middle, and migrants from Africa. Now, the million-dollar question is that, is migration good for the economy? And this question has been a hot debate for a number of years, but as the discourse has been driven, by several motives. It's been largely driven by ill-informed perceptions, and this has been leading to public antagonism towards migration. And these negative views risk jeopardizing efforts to adapt migration policies to the new economic and demographic challenges facing many countries. Whatever is source, migration is important, and it has really significant impact on our societies, which at times could be controversial, and the economic impact is not left out. So in the next couple of slides, I'll be talking about the overall benefits of migration before I jump into the country-specific benefits. Now, for the labor market, migrants have consistently accounted for a larger part or a significant part of the workforce of developed countries in the US and in Europe. And they are also found in really specific areas that are crucial to economic development, both in fast-growing and declining sectors. And younger migrants are better educated than those nearing retirement. And in the US, the trend even looks like younger migrants are better educated than the native migrants of the same age. And they continue to play a significant role in the most dynamic sectors of the economy. And they are seen in really important sectors that I've mentioned, such as healthcare or STEM occupations. How do migrants or their activities contribute to the public purse or the purse of the government? They pay taxes, and they also contribute to social welfare programs than they receive in benefits. And labor migrants compared to humanitarian migrants have a more positive impact on the purse of the government, and employment still remains the single biggest determinant of their contribution to the fiscal change of the country. In Switzerland and Luxembourg, for example, they have immigrants providing a net benefit of about 2% to the GDP, and this means that they contribute to financing the public infrastructure. Also, although they don't use it as much or at almost an equal rate as native bonds. And for the economic growth, as I've mentioned before, due to the demographic shift, it boosts the working age population of the receiving country. And also these migrants, because they are highly educated, arrive with skills, and they contribute to human capital development. And also, when they arrive, they contribute to technological progress. And this is for countries that are driven by research and innovation, which is what we'll see in the case of the United States and other developed countries. Now, this is a hot topic that we've been airing since late 2019, all through 2020 until now. How has COVID-19 impacted migration and its benefit? And the pandemic has affected how we do everything, and the migration is not left out. And you have disruptions in movement, from border closures to travel restrictions. And as of this morning, you have more countries joining the wagon of travel restrictions, and this is because of the news of the new Omicron variant. So it's still very much affecting our lives. And statistics that showed that there was a 27% reduction from the expected growth from 2019 to 2020. I believe that there may be a bounce back or even much more decline. We don't know what the Omicron variant is going to do by the time we have 2021 statistics. And it's so bad that the UN Undersecretary in a statement mentioned that the pandemic has impacted the livelihoods of millions of migrants and their families, and it's further undermined the progress in achieving the Sustainable Development Goals. So looking at country-specific impact, I'm going to start talking about the United States and the impact of immigration on their economy. As I've said, the US is home to the largest migrant population in the world. And as of 2020, they had a total of 51 million international immigrants, and that's 18% of the total global population. And these people work in different jobs that are very different from the native-born workers. So the graph on the right is, I think it has up to 2019, which is why it has 44 million. IOM has the more recent statistic. Now, even with the fact that we've talked about how impactful immigrants can be in the population, aggressive steps were taken to restrict the flow of migrants during the Trump administration, which I'm sure we're all aware of. And this was because it is thought that it negatively influenced the culture and the economy. And they went as far as saying that it was linked to criminality and it suppressed wages for native-born Americans. The question is, does restricting immigration really improve wages? Because it looks like they went down the same rabbit hole once again. Limiting immigration does not translate to increased wages for natives, and a review of the 1920 immigration quota showed no increase in the wages for native-born workers. And for those of us not familiar with the 1920 immigration quotas, it was this law that was made at that time that limited the number of aliens of any nationality entering the US to 3% of the foreign-born persons of that nationality living in US at that time. But at that point, some special categories of occupations were excluded from this quota, like actors, lecturers, nurses, professors, and all of that. In fact, they said they saw a decline instead of an increase in wages, which shows that it didn't work in 1920, and this evidence or supporting evidence should have been considered when these restrictions were going to be made in 2020 or whenever it was made during the Trump administration. As for the economic impact of migration on the US economy, immigrants are innovators, job creators, and consumers. And it is in fact said that the US needs immigrants to stay competitive and drive their economic growth. They create employment opportunities and they lead to the increase of the workforce and also increase the GDP of the country. In 2016, they added $2 trillion to GDP, and in 2018, they paid a total of $458 billion in taxes at the state, local, and federal level. And in the same year, after paying all of this in taxes, they still had about 1.2 trillion to spend on purchasing goods, services, and invest back into businesses. And they also appear to take up low-skilled jobs that natives would either not take or they are not willing to take. And these jobs, if not taken, could create bottlenecks in some specific areas, even though it looks like they are low-skilled jobs. And overall, immigration improves the labor market efficiency gains, and this amounts to about 5 to 10 billion annually. As migrants are saying, an increase in their population, there's like a simultaneous increase for natives, and this is termed the immigration surplus. And this is like a measure of the total gains or how much the native gains from migration. However, not everyone will benefit from this immigration surplus. It's been said that the owners of capitals, the investors, and the big players are the ones that benefit so much from the immigration surplus. Now, to talk about the fiscal impact, immigrants, whether they are documented or not, net positive contributors to the federal budget. And because they're generally of the working age, they impose relatively small costs on Social Security and Medicare, which are social security programs or welfare programs for older people or those in the low income. And these two programs, they are like the largest component of non-federal spending. And also the taxes that migrants would pay contributes to fund spend on defense, reducing the federal tax burden on the average Americans. And immigrants, in turn, do not place any burden on the defense budget, so meaning that they pay more and they get less. And in 2011, 76% of patents from top US universities had at least one foreign-born author, and a direct link has been established between skilled and innovative workforce and a faster GDP growth. Over 75% of US growth in the last 50 years has been attributable to improvements in education and research-driven innovation in which immigrants are deeply involved in. And for the impact of the population, the United States is not left out of declining birth rate or a low birth rate that has been seen in developed countries. And if this trend is allowed to continue, it could affect the economy and also, as I've said, about the demographic shift. So it looks like immigrants are coming in to like buffer the effect of the declining birth rate. And it's been projected that the US needs to double immigration rates to remain globally competitive and maintain fiscal programs. So the US is also saying the same thing that has been said by the European Union or the countries in Europe. So what impact do immigrants have on the American workforce? They participate at a higher rate in the labor force than native-born workers, or a slightly higher rate, that's 65.7 to 62.3%. And they launch new companies at twice the rate of native-born Americans. And as I've said, you have increased employment opportunities, they are boosting wages, and they are strengthening the middle class. So in this case, they are not people or groups of people to be seen as a competition. Rather, they complement the American workforce with the different skill sets that they bring. And for education, immigrants have been said to be well educated and skilled in their field, and 43% of recently arriving immigrants are college graduates compared to 29% of Americans. And also their children are more educated, they earn more, and they work in higher paying jobs than their parents. And even the children of the least educated immigrant origin group have closed most of the education gaps with the children of natives. And over half of the science, technology, engineering, and math degrees awarded by US universities go to international students. And as I've said, you find them in important sectors like the health sector, like IT sector, and also they are overrepresented in academia, engineering, and health professions. And half of the H-1B visas given out in a year go to people that have a master's degree and above from US university. And let's not forget that when people come in, or majority of people that come into US pay for these degrees at a higher rate than native-born workers, meaning that the country also gets more from people coming out of the country to study. And overall, 45% of Fortune 500 companies were funded by immigrants and their children, and they've employed over 10 million people globally. Now, about housing, the slowing rates in the US population means that they won't live in their house themselves, so immigrants also would have to come in to fill this gap. About immigrants and the aging population, the declining age rate means that the workforce is shrinking. So promoting immigration and immigration policies would reduce population decline, keep the size of the labor force from shrinking, improve age dependency ratios, and produce positive fiscal gains. And this was from the National Academy of Science. This was from their report. So the overall benefits for the United States means that encouraging immigration could result in greater occupational specialization, and immigrants and immigration are good for the country, the communities, and the economy. And when they come in, they help to drive business creation, they fuel innovation, and they fill essential workforce need. And also family-based immigration promotes family unity, integration, which are all core principles of the American value. Now, I'm going to flip the other side of the coin. What is the benefit of immigration to the Nigerian economy? And as we can see right here, I don't know how big this chart is on your screen. The first chart is from 2000, a report from 2000, and then this shows the current figures. So 20 years ago, the number one country that Nigerians are moving to was Sudan. And I'd like to really know why or what was driving the movement at that time. This was followed by the United States, United Kingdom, Cameroon, Ghana, Nigeria, and others. But in 2020, this are the top 5 countries that Nigerians were moving to. Now, Nigeria is the most populous country in Africa. It's the 7th most populous in the world, and it is projected to be the most populous by 2100. And a survey by the Pew Research Center stated that 45% of Nigerian adults said that they plan to move to another country within the next 5 years, which is a lot, I would say. But one thing is we don't know how representative this survey was, but if you would ask me, this is a lot. And the top birthplace of among African immigrants in the US is Nigeria. And in 2017, 6.2 billion was sent in remittances to Nigeria from the US alone. And 6 in Black Nigerian immigrants in the US had a bachelor degree or more education. And it's been said that Nigerian Americans have more postgraduate degrees than any racial or ethnic groups in the United States. About the remittances, I'll be talking more about this in the following slides. So for immigration to Nigeria, it's not surprising as the most populous country that people and largest economy that people would want to come to Nigeria, and it's was an important destination and remains an important destination for migrants in the West African region. In 2010, it was expected that the number of migrants to Nigeria would cross the 1 million mark. I'm very sure it's more than that now. And most people coming in would be from Benin, Ghana or Mali. And you also have refugees and asylum seekers as part of this stock. And it is also a destination for highly skilled migration, such as professionals, managers, and corporate workers. For immigration out of Nigeria, you have more people moving out of Nigeria than you have moving into Nigeria. And this, you see this more in people with high skills or high education. And in 2000, it was said that 10.7% of the highly skilled population who trained in Nigeria worked abroad. I am very sure that this statistic would have increased now. And now we are seeing an increased rate of education-related migration. Most people leave the country for their bachelor's, for their master's, or even PhD. And the flow of remittances increased dramatically from 2.3 billion in 2004 to 17.9 billion in 2007. And it's still increasing because I have the most recent statistics on that. And as at that time in 2007, it accounted for 6.7% of our GDP. Now, remittances as a benefit of immigration, and this basically refers to the transfer of money by foreign migrants or those living outside the country to their home countries. And the global remittance market is very vast and it impacts both low income and high income countries. You have about 500 million people depending on this inflow of cash. And you have the transfer or the exchange of this money being taken care of by banks, money transfer operators, mobile network operators, and others. And much recently, you've had fintech startups and all of that doing this in Africa. So I would say that remittances is, what should I say, encouraging innovation amongst Nigerians or Africans, and it's something that should be encouraged. Now, the market size was valued at 682 billion in 2018, and it is projected to reach 930 billion by 2026. And this monies are being gotten from salaries or other activities that migrants would engage in their new countries. And it's been said that this money might be more than this. This is just records that you have via approved channels. What about money that is being sent by non-approved channels? So again, to developing countries or lower middle income countries, it looks like remittances is the biggest benefit that they get from immigration. And it was said that the increase of inflow and remittances to Nigeria was prompted by the renewed confidence that people had in the economic reforms and the increasing investment opportunity. But with this renewed or increasing remittances to African countries, and not just Nigeria alone, the average cost of transferring money to sub-Saharan African countries is the highest globally. You have people around the globe paying about 6.2% of the money they want to send, and it stands at 8.96 for Africans. And this high cost is impacting the life of the families and the African economy in general. It has been said that in 2019, the excess fees charged for remittances to Africa stood at 1.8 billion alone. And overall, remittances have contributed to the development of Nigeria, and it's been termed a major indicator of the impact of migration. Now, this chart shows the remittances from immigrants from the period of 2004 to 2007, and this right here shows a much more recent statistics. So in 2018, Nigeria was the 5th largest remittance recipient nation around the globe, and the remittance accounted for 5.74% of the GDP, and it is expected to increase to 25.5 billion in 2019. And if you have this happening, how does it look like the government continues to make policies and other laws that would stifle the flow of this fund that is clearly helping the economy? So in 2018, the remittances increased by 14% from the previous year, which is 2017, and it consisted of 83% of the federal government's budget for the year and over 10 times of the foreign direct investment flow. And in the last 6 years, you have expats making transfers to the tune of almost 100 million. A majority of this money sent is used for consumption and spent in the health sector, education sector, and the remainder is invested by the recipients and the remitters to buy shares, stocks, and also build houses, which I think is something common to us in Nigeria. And it's also used for community projects, education, health, and recreational facilities. So overall, even those that do not migrate benefit from the outcome or what people get of migration. Even people at home benefit from it. So if we have the advantage of remittances to, or of the advantage of immigration to the economy as remittances, or the Nigerian economy in specific, is there a disadvantage? And of course, that would be a big yes. And the price we'd have to pay for this as a developing country is brain drain, which is the movement of highly skilled individuals from Nigeria to developed nations. And this induces shortages in manpower in key activities, and it undermines the ability of the country to grow and develop new technologies or even deal with health crisis, which is very important now that we have been facing COVID-19 for the past year. And it's interesting that even with the shortage in manpower, Nigeria is doing tremendously well in handling COVID-19 crisis and also with the surveillance and all of that. So that's kudos to everybody on ground. And even at that, they shouldn't be so strained. It would be good to have more of these brilliant minds right here in Nigeria, working on the best way to stop this pandemic. And it increases technological gap between leading and developing countries, which we've seen now. Developed countries would do everything to have these brilliant minds over there so as to stay ahead of every other country in the world. And it has a direct and negative effect on the quality of service delivery to the public. And this is not rocket science. You have more skilled people leaving, so the people left with the gap, they would offer whatever quality of service they have to the public, and this is something very, very dangerous. Also, this brain drain has led to the fall in quality of education, and it is discouraging the process of knowledge creation. Remember how countries like the US bank on education and research-driven innovation, so it is something that we need to do better. Overall, brain drain is anti-developmental, and it's really a great constraint on the development of low and middle-income countries. And we would implore the government to address and review all the policies that have triggered this outward movement of intellectuals, and also provide a conflict-free zone for people to discuss and also plan on how to make their return to the country fruitful and impactful to the development of the
please
nation.
round up, conclude, please. Thank
And
you.
this is the penultimate slide. So in conclusion, you have people outside the country contributing to the growth of the company by foreign investment, trade, and financial inclusion. And national strategies and international cooperation will be needed to mitigate the effect of the loss that we've seen from the reduction caused by the pandemic. Overall, immigration is a positive but also a disruptive change, and countries have to be ready to deal with this change. And we would need to have discussions, continuing discussions about topics essential for policy formulation and how the impact of migration would be maximized for countries of origin and the destination countries. And I would like to thank you all for attending this presentation. I would like to thank the Center of Excellence in Migration and Global Studies for giving me this opportunity to talk, and most especially the Director, Dr. Gloria Neto, and also thank the Department of Preventive and Community Dentistry, University of Iowa, for giving me the opportunity to further learn, and everything that I've learned obviously would be used to benefit the country, the nation, and the world. Thank you, everyone, for listening. I'll take questions now.
Yeah, thank you so much. This is a fantastic presentation. I really enjoyed every bit of it. This is excellent. You can see how everyone is clapping for you. Well done, thank you. I am particularly impressed because if you as a medical person can go very detailed into economic assignments, I'm really impressed. Thank you so much. So this is the next session now is for us to give opportunity to people to react, comments, questions on this presentation. I must also say, I really appreciate the slides, the way they were presented. I mean, the colorfulness, the nice description is really beautiful. So well done. I'll give people the opportunity to comment.
Thank you, Dr. Anita.
I am yet to see any hand up, but I want to recognize the presence of pardon? Did anybody see?
Stop sharing.
Let us have people who want to ask questions. Yes, I can see Emeritus Professor Sogolo. I can see our former Vice Chancellor.
Great Abdallah Uba. He just left another meeting to come in here now.
That's right. We were at another conference in NOUN.
And who has?
Yeah.
I think you just need to go to the share session and click on it. Share screen. When you click on it, it will show you whether you want to stop sharing.
Sorry, I only listened to a part of this. I did.
Okay.
I did, yes, because we were in another meeting.
Okay. Professor Tijani, any comment from you? Can you hear me?
Yes. We actually started this center on the platform of a transdisciplinary approach, and presentation should always address that. We succeeded in winning the hearts and minds of so many, and I think the trend continues. I am not shocked by the brilliant presentation of the young scholar, and that is why I encourage some of the, even all the TED Fund sponsored doctoral students, as well as the postdoc fellows, to join. Of course, I can see a very few of them, and I'm not impressed. I'm not impressed because they have lost opportunity to learn from this young scholar who is not primarily a historian, an economics, neither is she trained as a sociologist or a political scientist. She is a STEM trained scholar. But I am very, very impressed about the pedagogy in which she was trained and her ability to maintain such. Not because she is in the United States, but I think from the bio read by the director, she began her career or her studies in Nigeria. At least she had a bachelor's from a university in Nigeria. Kudos to those teachers, but more importantly to the learner for making us proud. I'm saying this for emphasis. Why? Because a dentist that can venture and brilliantly present beyond the powerful PowerPoint, color, and what have you, brilliantly present and even answered the 7th question I was going to ask of her. I just say thank you. But nonetheless, I want us to address the following. You mentioned, Dr. Oladayo, you mentioned the issue of remittances, and then you dove into US activities and what have you, which is good because it addresses the issue of moving from the general to the specific, which I have noted here, and also contextualizing the examples, which you brilliantly did. I'm not too sure whether the US immigration law of 1920, and then you mentioned Donald Trump. You probably want to clear that fuzziness for the general listener. That is one. Two, remittances. What are the policies on the side of the homeland? I'm sorry, the country of origins. In this case, you also use Nigeria, which is okay. What has been the policy? Are we just using Remify, World Remit, and other companies that are making the money, and the banks that are now making the money, telling you you're getting your dollar or pounds, not Naira? You want to shed more light on that. You mentioned Sudan as, surprisingly a place that Nigerians venture into or settled. I'm not too sure whether you have statistics to back up their permanent residency, or was it a transition? I believe Sudan was and remain a transition for, that is Sudan and Libya in particular, for transition into Europe. And you may want to discuss that or shed more light. Lastly, for me not taking too much time, of course I joined before everybody today, thank God, 6 hours ahead. It is 7 hours ahead for Abim in Iowa. You mentioned Social Security and Medicare. And I'm wondering whether you have data, or you should collect data if you want to venture into that, because the issue is that whether you like it or not, most people don't have to have Social Security number to really get and cross the line for Social Security benefit or Medicare when they are 60 and above. And why am I saying that? You have to remember the TITN that most often go to Department of State or Commerce, and then they get that number. The number is the same as the Social Security 9 digits, and they use it. We have so many illegal immigrants using it, and they still fight taxes. When they are of age, they use that number. So again, you have to look into that. Lastly, Indians, explanation for Indians late. I was looking for you to give example, but I can offer one. the major reason for Indian large population, particularly in the United States and Canada, is as a result of the H-1B visa, as well as the EB visa, employment base. And then you see most of the companies sponsoring this H-1, and by extension H-2, for professionals are also owned by Indians, and they effectively utilizing that. But because of the corruption that system is saddled with, you will see a clampdown in recent time, and some people even going to jail. But again, I thank you for this brilliant learning moment. You've done us proud. Ibadan should be proud of you. Nigeria should be proud of you, and the United States, your host, where you do your postdoc, should be proud of you. Thank you very much for allowing me to speak for this length.
Okay, thank you, sir.
So do I wait for more questions or I respond to Professor Bikoli? Dr. Nita, can you hear me?
The last name is Tijani, not.
Okay, Dr. Tijani, Professor Tijani. Apologies for that. Okay, so for the 1920 immigration law that I talked about and Trump, so basically it's one would expect that new laws or restrictions are made based on evidence, like evidence-based action and policies. So now you've had you've done something like that in 1920. That's over or close to 100 years, and again you still want to do it again. And at that time, it yielded no result. So the question is, why do you want to do something like that again? Is there something you learned at that time, or the country learned at that time, that should have been used instead to make migration a more beneficial venture for the receiving country, in this case, America? So it just looked like a policy that was not well thought of, particularly when you had something like that happening before. That was why I used that in 1920, and then the most recent restrictions that
Mr. Trump. The Trump restriction, right?
Yes, yes.
Okay, thank you. That clears it here then.
That clears it. And then for the data or the statistics on Sudan, as I mentioned, that was in 2000. So I am not so sure. So I'm not going to categorically say that if we had more people going through back doors to leave Nigeria at that time. As I've said now, you have migration, it's easier than it used to be. So now are people using more legal channels to move compared to what we had in 2000? So if that happened, it's going to be like, oh, okay, everybody trying to leave the country by all means, or most of the people went through Sudan to transition into European countries. So that might be an explanation, and I'm going to check that out. And for Social Security and Medicare, remember that I dwelled so much on people in the workforce. So those contributing legal labor immigrants will be the ones that would be contributing so much to Social Security and Medicare, not the undocumented or the illegal immigrants. And then for remittances and getting money in USD or in Naira, I think the government and the Apex Bank has a lot to do. Like going forward, it's like they are given a particular set of migration power.
Okay. Oops.
Hello.
We can hear you.
Yeah, please. Yes, I think because of the internet, you couldn't hear me. Usually, we wait for all the questions and comments before responding. So, but it's good that you're almost done with responding to Professor Tijani's own. So thereafter, you kindly wait
for everybody.
Yes, for everybody. Thank you.
All right.
So are you done with Professor Tijani? If you are done, then Professor Sogolo will come up.
Yeah, I was just wrapping up on the last question that the government and the Apex Bank has a lot to do on regulating policies and how monies come in and how it's paid out, because it looks like now we have a lot of private players and people with their own interest, dominating that market. So I think that's a lot. That's still an aspect that a lot of work has to be done. And until that is done, it's still going to be biting the purses of people sending money and the people they are sending it to, which is unfortunately us. Thank you, sir.
Thank you so much. So, Professor Sogolo, sir.
Yeah. First of all, did I hear Professor Tijani say that Oladayo is from Ibadan?
Yes.
Oh,
she's an anomalous.
Okay, so that really supports what I'm about to say, because you don't expect anything less from Ibadan. And I'm really impressed, by, two things. One, the clarity of the presentation. From the part that I listened to, it was so clear that you sequentially, she was making the point, and I think the presentation was very good. Then the second point is that you find that she has figures to support every point. That's the essence of research. And I think, it's a good thing. I'm not going to go beyond that, but I want to congratulate Oladayo for this brilliant presentation. Thank you very much.
Thank you, sir. I don't know if Professor Abdallah is still around. I saw his hand up sometime. Okay.
He was making some signs. It looked like he had some problems. I don't know.
Okay. So if there are no more hands up, then I think the presenter can round up. I don't know. Is there any? Okay. No, nobody is raising up hand. So I really want to. Okay, there's one Isiaka Owolabi with hand up. Can you please unmute yourself, sir?
Okay. Can everyone hear me?
Yes, we can.
My name is Isiaka Owolabi. I'm a scholar from Tokyo, Japan. I really enjoyed the presentation by Abim. And I'm also very surprising that someone that we trained as medical experts were able to, dig out the immigration and the economic accord between one of the two giant countries in the world, Nigeria. We cannot deny that. So my question to Abim is about I think you mentioned health insurance, which I know virtually that it's not that prominently or acceptable in Nigeria. Do you able to, have clarity? Because I know, like in Japan and the US and other developed countries that I know, it's compulsory, if I'm not mistaken, to have health insurance, which medically they're going to cover about 75% of your medical bill. And I know people back home in Nigeria, which I know they are struggling. You will see in social media, people begging for money for medical aid, which I know that out of ignorantly, they don't know that the health insurance is so beneficial. And the least amount you pay, you are going to, because the people pay for this money, and then when it's time for you to need them, they're going to use the money that's being paid for everyone. For example, like someone, you have a medical bill of 1 million naira, and you'll be surprised that they'll just tell you to pay only 200 naira. 200,000 or 100,000, if I can say, in Japan, for example. So the question I want to ask to you is, do you know that, or there is any advice you can give to Nigerian government? Because I know this is very respectable organization in Nigeria, the National University Commission, if I'm not mistaken. And I know the voice will be heard. I'm seeing the powerful professor here, that they can able to all do some more research. We can do some kind of publication awareness to people to know the benefit of the health insurance?
Thank you so much for your question. I think I'll try to go straight to the point, but then health insurance looks like a really complex topic. And I assume that you drew that from when I mentioned Medicare. Now, Medicare and Medicaid, which I didn't talk about, are social plans that are well laid out. And it's not something you can escape from. Do you understand? There's a particular percentage of your earnings, that's if you're legal, that goes to that. And the government, has like a center that organizes that. You have the CMS. So starting that discourse in Nigeria, we would need to ask the first question: how organized is the National Health Insurance Scheme, or whichever body that is in charge? And if it's organized, how integrated is that into people's wages or their earnings? And I know that at some point during my house job, I was paying for health insurance, but that was T-ship, which wasn't I'm not sure if it was under the NHIS. So in this case, how do we bring something with so much benefit like that to everybody, to make sure that people that are employed by the government, not employed by the government, everyone has access to registering and also keeping up? And much recently, I've heard that private players in health insurance, the HMOs and all that, they get very reluctant to pay out hospitals. And in this case, hospitals too, get very reluctant to accept health insurance. So in this case, how or what are we doing about, healthcare financing and healthcare access? So it goes beyond having that central body. In Nigeria, do we have the central body? How organized is it? And then how integrated is it to the lives of people? And how is it for people to pay? So we're asking so many questions, or we need to be asking so many questions. And I don't know if anyone is able to, chime in on the state of health insurance in the nation. But as I've said, it's a very, very complex.
Thank you so much for that
discussion.
response. I cited the Deputy Vice Chancellor, Technology, Innovation, and Research. So since we are talking about research here, I would want her to comment on this presentation and if she has any questions. Professor Monioluwa Olaniyi, ma, you are to say something to this, our scholar. Is she there? Maybe she's having problems. She's there. Okay, maybe she's having a network challenge. So, but I will just, if we can't get her, then I may need to round up. And if I'm rounding up, it's just to really appreciate you. And I also appreciate how I met her.
She's there.
Okay, it's Professor Lani.
Thank you.
Okay.
Thank you so much. My internet connection has been very unstable.
Yes, it's been very unstable around here. Yes.
Thank you so much.
Okay. We wanted you to say something about this interesting economic problem being solved by our medical experts.
I must commend Dr. Oladayo for the interesting and expository presentation, actually. I think she spoke from both ends, somebody who had been here and somebody with over there. So she was able to properly connect the situation. I would like to just say that the economy aspect of this migration, the government will have a way of properly harnessing this contribution. And then if we are able to improve on our image, then illegal migration probably will be curbed to some extent. Thank you.
Thank you very much for that contribution. I can also see some colleagues that it's not only the senior ones that can have something to say. I can see Dr. Oame here, Dr. Felicia Oame. Yes, that is one of our editors in our journal. You know, we have a journal where we are going to publish Dr. Oladayo's work. She's going to write it up, and our journal is international. So once you present with us here, we put you on the international pedestrian. So you are going to be able to publish your journal in our International Journal of Migration, of Migrations and Global Studies. And so we will be expecting Abimbola to make any necessary corrections and send in our paper for peer review. It goes through serious peer review, and then we publish. I saw Dr. Oame and I wanted her to say something. Is she there? Yes, I can see she's still online. Dr. Oame. Maybe internet has been quite unstable. And there's somebody, yes, I can see Dr. Abisoye. She is always here regularly. Dr. Abisoye, can we hear something from you? She's a lawyer. She may have something to tell us about one or two comments. Dr. Abisoye, since you cannot get Dr. Oame, can you quickly say something? Okay, I want to believe maybe people have unstable internet. Okay, if no other person is there to say something, then I will really want to call it a day. I really thank Dr. Abimbola Oladayo for this very, very enlightening presentation. She has done justice to her topic, and we really appreciate you. And we want to encourage more people, young and old, to come on this platform and share knowledge with us. And like Professor Tijani said, it is a platform that is for all disciplines. You don't have to be in the arts or social sciences, like Abimbola has been able to show us here. You can be an engineer, you can be a doctor, you can be a lawyer, any profession at all, any discipline, and yet you have a place in migration and global studies. So having said that, on this note, I want to say a big thank you to all the attendees, and to let you know that we are still very much on. Next week, another presenter will come with a very interesting topic, and same time, same day, next week. So I want to thank you and wish you a very good day. Thank you so much.